In this article, different roles of psychologists are tested to see if there are any conditions of working in correctional institutions that affect psychologists of multiple backgrounds and how the results of this are drawn to a conclusion. The authors clearly issued that psychologists play a larger role in the growth of the industry. They surveyed about 2,000 professionals. These professionals were all given questionnaires that range from topics such as demographic, job duties, responsibility provisions of mental health services, assessment practices, and training recommendations as a result of the questionnaires. The authors concluded multiple points and perspectives within the 2,000 people questioned. Some 600 of them were working at a master's and doctorate level. It stated that correctional employees with master's degrees are more prepared to work than those at doctorate levels with mental health instruments, as well as employment levels varying as shown within the demographic questions. These were there was a smaller number of women employed by correctional institutions compared to those of other groups questioned. Mainly, a lot of the groups differed from race, ethnicity, um, religion, as well as language and other backgrounds. Also, correctional psychologists are more likely than normal psychologists to endorse cognitive and behavioral orientations as guides that result in positive treatment methods. Multiple treatment methods included the behavioral orientations that were used in the past and present. Psychologists mainly dealt with prisoners who mainly have depression, anger, anxiety, and adjustment issues towards the environment of the correctional institution. This shows that in some state institutions, psychologists suspect professionals to be isolated and feel burnt out as a possible consequence of working with specific cases that have to do with prisoners who are lifetimers depending on what they've done in the past or what they've done or if they're there for a short period of time, mainly varying from grand theft or other cases. Some other positive treatment methods include more one on one treatments rather than those of groups that are mainly used with multiple prisoners in a specific environment with only one psychologist. In essence, the authors do believe that since there was a lack of similarities and roles within state and federal prisons, juvenile institutions, and youth detention centers, they believe that psychologists in these settings are less connected to other mental health professionals that can be categorized with the background of the psychologist questions. Also, mainly a lot of the psychologists questioned in this specific survey were mainly from um, state and federal prisons or mental health correction centers, um, as well as mainly they depended on different degrees, different instruments, different time periods. Mainly, this entire survey was predicted to be at least in 1980s, resulting from different resources that were also mentioned by the